Okay, so today I will do a sort of response to this feminist organization Alliance for Reproductive Health Rights, which says, quote, FGM is not the same as male circumcision. It has dire health consequences on females who undergo the process. Hashtag end FGM. And they say in the same post here, myth, female genital mutilation is the same as male circumcision. Then they say the truth, male circumcision is the removal of the foreskin on the genitals. FGM, on the other hand, is the cutting and/slash or partial or total removal of the genitals itself. This causes numerous harmful effects on females who undergo the process. So a number of things. First of all, foreskin belongs to the genitalia, okay? Now, again, these feminists are the enemies of men and boys, as you can clearly see here. They try to downplay the severity of MGM, male genital mutilation, okay? In a disgusting manner, okay? So these feminists are actually pro-MGM because, again, they are downplaying its negative effects, okay? So, and by the way, as an MRA, I'm against both MGM and FGM. Now, the difference is that MGM is legal everywhere, okay, and practiced pretty much everywhere in every country. FGM is not, okay? That's the actual difference between the two. Both are bad, okay? Now, again, MGM, for example, results in the death of babies. Alarm as 6 boys die in botched circumcisions, okay? Here's more. 5-year-old dies after circumcision at United Medical College Hospital. 20-day-old boy bleeds to death after 2 women perform home circumcision in Italy. This is all very recent cases. Or this here, serious and fatal complications after neonatal circumcision. 1 infant was taken to the operating room to remove an obstructing plastic bell ring. 7 boys were admitted to the intensive care unit with severe bleeding or sepsis, 3 of whom ultimately progressed to hemorrhagic or septic shock. 2 of these children died of their complications. Okay? So these feminists who downplay MGM, they want baby boys to be tortured, and ultimately they want them to die. Okay? They are sadists. Pro-cutters are nutters. Okay? And people who downplay circumcision or male genital mutilation, as it should be called actually, these people are criminal misandrists and evil. Okay? They're sadistic torture enjoyers. Okay? Okay, this is what feminists are, by the way. And intactivists who don't kick out the feminists among their ranks or any or have any alliance with feminists, they are not real intactivists. They are actually part of the problem. Okay? Here's also a very long list of circumcision deaths. Okay? Very long list. Here you can see it. Okay, and this is just what we know. This is just what we know. This is the extent of what we know. Ryan, look at how long this list is. Okay, you can just scroll and scroll and scroll. Okay? So, downplaying the severity of MGM when it is literal torture, okay, that can also result in death, is disgusting. This review, the systematic review here, has shown 47 specific complications arising from male circumcision surgeries. Okay? This is a long list of potential complications. But even if there were no complications, the process itself is excruciating pain. Okay, it is torture, and it also leaves the male with psychological scars and with physical scars as well, and with other adverse health consequences. Okay. Now here's a great website which I want to promote: Doctors Opposing Circumcision. Right? This is a really good resource that not only fights against circumcision but also debunks many claims. Like many people excuse or try to justify circumcision by citing so-called medical benefits, and this website just debunks all of these bullshit claims about so-called medical benefits. There are no medical benefits to circumcision. Okay? So, for example, phimosis, urinary tract infections, sexually transmitted infections, HIV, cancer of the penis, prostate cancer, cervical cancer, and stuff like that. People always bring these things up, right? Especially phimosis, right? So let us check this claim out real quick, because they actually debunk these so-called health benefits of circumcision. The term phimosis loosely describes the condition in which the foreskin cannot be drawn back, retracted, to uncover the glands or the head of the penis. Unfortunately, the term has been misused for over 100 years and inappropriately used as an excuse for circumcision. It has been used to refer to both a normal physiological developmental stage in children, as well as to pathological condition, usually of adults, but rarely found in children. This is a very crucial point, okay, because these circumcisions that are done on children, they're excused with phimosis, yet children actually don't have phimosis, okay? The former requires no treatment whatsoever, and the latter can typically be prevented by proper care or treated conservatively, right, with steroids, creams, right? You don't even need, as an adult, circumcision. If you have phimosis, you can just use alternative treatments like laser treatment or steroid creams, right? They're alternatives, right? Even when, as an adult, you have phimosis, which is also very rare, right? It's very rare. It is important to distinguish between these two. Okay, normal physiological non-retractability. Okay, this is what children have, non-retractability. Yet some quack doctors out there who wanna circumcise a helpless baby boy, at birth the foreskin is usually fused to the glands of the penis and cannot be retracted. A non-retractable foreskin in itself is not a disease, but a physiologically normal developmental stage in boys. There is no set age by which a boy must be retractable. The foreskin gradually becomes retractable all by itself between infancy and early adulthood. About 50% of boys are able to fully retract their foreskin by 10 years of age, and only 1% of males aged 18 plus have a non-retractable foreskin. In the absence of tissue changes indicating a disease process, a diagnosis of phimosis in a pathological sense is inappropriate for most children and adolescents. Okay? Now they go into more detail, right? And they also have references to studies, so they back up what they're saying. Okay, they're not just pulling things out of their ass, right? And here also a list of medical organizations that are actually against circumcision, right? So there are a number of different medical organizations that are against circumcision. So the Canadian Pediatric Society says the Canadian Pediatric Society does not recommend the routine circumcision of every newborn male. It further states that when medically necessity is not established, interventions should be deferred until the individual concerned is able to make their own choices. Okay, and other medical associations, the Royal Dutch Medical Association, the Royal Australasian College of Physicians, British Medical Association, German Association, okay? And there are also several critiques of the US medical organization's statements on circumcision, which support circumcision, and there are a number of doctors who have criticized these organizations that support circumcision. Okay, so like the CDC, for example. Okay, and also here's this narrative review: social and psychological effects of circumcision. A narrative review. Okay, let me just show you how painful circumcision is. Okay, because it is painful torture. Okay, infant pain and behavioral response to circumcision. To fully understand the long-term effects of circumcision, it is necessary to review its effects on the baby. The problem of baby pain often comes up in discussions about circumcision. Some doctors believe early studies claim that the neonatal nervous system is not sufficiently developed to record or transmit pain impulses. This is a bunch of nonsense. Of course it is fully developed already. According to a more recent study, this belief is doctors' master myth about infant pain. Babies' inability to resist physically and not end the circumcision process makes relieving their pain easier. Some doctors minimize foreskin pain by calling it discomfort or likening it to injection pain, but empirical studies have rejected these studies. Right, because it's utter nonsense. Of course, infants feel pain if you torture them with circumcision. Anatomical, neurochemical, physiological, and behavioral studies confirm that the newborn's response to pain is higher than that in adult subjects. You see, in newborn it's actually higher than in adults. Infant circumcised without anesthesia, reflecting general practice, have an increased risk of significant pain, choking, and difficulty breathing. Increases in heart rate of 55 units have been noted, i.e. 1.5 times the baseline heart rate. After circumcision, blood cortisol levels increased 3 to 4 times compared to pre-circumcision. Circumcision as a surgical procedure has been described as one of the most painful practices in neonatal medicine. The researchers reported that elderly patients would not tolerate this pain level. Okay? Even elderly patients would not tolerate this pain level, yet we believe that infants gonna tolerate this? Really? And by the way, anesthesia does not work actually. Okay? Here's a study on that. Neonatal infant pain scale in assessing pain and relief for newborn male circumcision. The results of these trials show that none of the anesthetic strategies used obtained the absence of pain. Some differences between circumcision techniques can be noticed, but most assessments exceed the score of 3 chosen as the clinically significant pain. Okay, so this pain relief, this excuse doesn't work. Okay, even with pain relief, infants still are in pain during circumcision. That doesn't really help. Okay, it's not an excuse. It's not an excuse. Okay, and lastly, I want to focus on how adverse childhood experiences correlate with circumcision. Okay, children from dysfunctional households experience a proportionally greater number of adverse experiences than other children. One such common event is male child genital cutting or circumcision. This study surveyed 500 randomly selected circumcised and intact men concerning their experiences before 18 years of age using the 10-item adverse childhood experience checklist. The cumulative scores for men with circumcised penises were higher on average compared to those for men with intact penises. In this cohort, male child genital cutting was more common in dysfunctional, violent households. Okay? And by the way, here it says some studies have concluded that the dominant deciding factor is the mother's preference or the father's penile status. Okay? This proves that mother's preferences is one of the dominating factors or the dominating factor when parents decide to have their child circumcised. Okay, and the father's penile status, that can also be something that where mothers are influencing the father and say, oh, look, you're circumcised, so that means our son also has to be circumcised, because mothers are controlling the family unit. They're the dominant factor in the family unit, so they have influence on the father. Okay, so the deciding factor is the mother's preference. Okay, mother's preference. It proves this. Okay, and there's also a subreddit that City Crusher showed where mothers were cheering gleefully about their tortured sons. Okay, their tortured MGM victim sons. This is evil. Okay. Again, this notion that women are the empathetic gender is a bunch of horseshit. Okay. Now, so this Alliance for Reproductive Health Rights is a hateful organization, a feminist organization. Okay. And it shows you that these feminists, they're just out to have torture for men and boys be continued indefinitely. Okay, so any intactivist who still is tolerating feminists on their subreddit or in their Discord groups or in their communities in general, they're controlled opposition. Okay, they're fake, ineffective, bullshit artists. Okay, thanks for watching.